go?
Cerebral spinal fluid.
Where does it go? Yes, where does it go? Where does it go in your body?
In your spinal cord and
system.
in your brain, around your brain.
Right, so it surrounds your brain. It's the cushion for your brain, right? It's a cushion for your brain. It's a cushion for your spinal cord. So normally, does that just easily leak out?
No.
No.
If it leaks out, would that be bad?
Yes.
So if we find it, is that bad?
Yes.
Okay, how do we find it?
A detailed
Yeah.
secondary assessment or primary, if it's really bad.
Well, I'm going with Annalise.
With the halo test?
Halo test.
Halo test, I don't know what the halo test is.
She's going to
This must be-
explain it.
This must be something new in the pre-hospital setting. Please, inform me of the halo test.
You take the little 4x4 and you.
Can you use a 2x2?
Nope.
Yeah.
What about an ABD pad?
Nope.
Trauma dressing?
Yeah, I mean, you
Has to be
use
4x4.
some sort of white gauze-like
Wait, I have a question.
substance.
Is this important?
Being able to identify cerebrospinal fluid.
So you see that thought process you just said, like, are you stupid? I mean, that's not really what I think every time you guys raise your hand. I promise. All right, go ahead.
So
couldn't
typically it's in
resist.
like blood, so you take a little bit of whatever is leaking out and you look at it, and if it's blood, that'll stay concentrated in that area, and then the cerebrospinal fluid will extend beyond the area of blood, making a little halo that's clear around it, and that's how you're able to identify it.
Something kind of like this, right?
You know what, that's a so much better illustration than my word picture I just gave.
I know. So you end up with blood in the middle, right? And then as it moves out, so instead of like, they call it the halo, but just know like, all of this area right here is not, it's not white, right? It's not like this set line that's out there. It's not like this circle that is there. It is a lighter tinge. So basically you'll get blood and CSF mixed throughout this, but the main blood section is right there in the center. So it'll be, basically it's diluting the blood as it moves out and absorbs through the 4x4, 2x2, ADD pad, whatever pad you're gonna use.
So if it's just blood, it's just gonna be concentrated.
Yep, it'll be a set blood amount there. The very edge of it may be slightly diluted because it's moving out into the 4x4 that you got. All right. So how does it get outside the blood or outside the body?
Something
From trauma.
Some part of its container is broken, right? And so if we know that it runs through the brain, down the spinal cord, what's the primary place you think it's leaking from?
Your ear.
So like what portion of your body do you think is broken?
Probably more in the head.
The brain, right? So like there's not a whole lot of a way for you to get your CSF out of your spinal cord, right? Like unless maybe you got some sort of crazy weird stab in the back and you got blood, that'd be kind of a fun halo test to try. Somebody paralyzed kind of thing. But that's why they do like lumbar punctures and stuff like that. They're checking the CSF for stuff, okay? So probably you have some sort of skull fracture somewhere, right? Bad? Can we
Yeah.
see skull fractures real easily? You got about a 75% chance because majority of your skull is all back here, right? There's not a lot of things blocking it, right? But then your skull moves all up in here and we had like 10 different bones in the face, right? So any one of these bones breaking in the right way can open up the cavity to allow for CSF to leak out. Blood supply stops to the brain, unconscious in 10 seconds. Oh, no kidding. Like, so in the fire service, we wear masks, right? Like we wear the breathing apparatus, right? So we practice and we practice and we practice about, hey, if we end up running out of air or something, we gotta disconnect, pop into somebody else, right? So I teach one of the classes for our recruit class of people that like, so you're in dark environment, you're out of air, you gotta go clip into somebody else. And we really ingrain in them, hey, do not take your mask off, do not take your mask off, do not take your mask off. So the idea is you have to consciously take the thought of I'm gonna go unconscious versus breathing poisonous, noxious gases, right? Because if you breathe the gases, you're dead. You're dead basically instantly. But if you go unconscious, you have 4 to 6 minutes that hopefully your crews will be able to get you air, right? So it's a conscious training of, hey, okay, can you legitimately force yourself to go unconscious, or are you gonna suffocate, right? So like 2 weeks ago, we're doing this training with these recruits, right? And thank God I gave a little pre-safety thing beforehand. I'm like, hey, just so you guys know, we're gonna try to do this, but if for some reason you can't make the connection, it's okay to pop your mask. Just pop your mask, right? So we go down and we're in the basement. You guys all had EMT rescue class, right? So you guys have been to our rescue house. There's a basement down in the bottom of our rescue house. We're down, it's pitch black down there. I'm sitting down there with a tick with these 7 people. And they're doing all their buddy breathing and stuff. And so then I separated them on 2 sides of the basement, and then they had to go find their buddy and stuff. And so I turned this one guy's air off, and so he's supposed to run over there, do his thing, make the connection. Well, he runs over there, goes to make the connection. Well, his buddy's already paired up with somebody else. So he goes to grab somebody else, and they're getting ready to try and make another connection. And he realizes, oh, hey, I'm not gonna be able to make this connection. So this is one of those moments where I was like, hey, pop your mask if you can, right? So I'm sitting there and I'm watching him, and he sits down, and he just starts pounding on the wall. And I'm like, oh, this is weird. And all of a sudden, like, I see him, like, start fighting his people. And I'm like, huh, that's weird, he's fighting his buddy. Huh. And I'm watching it, and so automatically I'm thinking, okay, something's wrong because these guys are now fighting in the dark. Right? And so all of a sudden I just see him, and he just goes, and he just rolls backwards onto the ground. And I'm like, huh. I'm like, please tell me this guy's not that much of an idiot that he legitimately took everything that we said, try not to do it, try to make this real, And I walk over and sure enough, I'm like, this dude did not pop his mask. So he had sucked it, caused himself to pass out, and was unconscious. So I reached down there and I popped his mask off, and he goes like that, and then all of a sudden he's like, I'm ready to go, I'm ready to train, sir, I'm ready to train. I'm just like, no, you're not. I'm like, we're taking a little time out here. And so, like, this whole 10 seconds thing all has to depend on how much activity you're doing, right? Like, this guy was out cold within probably 5 to 6 seconds, right? And this is a ex-Navy SEAL that has been through a lot of that type of training. And I'm just like, so every time I saw him, I'm like, all right, dude, so apparently we've got to babysit you and make every decision for you because, like, you're going to go full on, like, I put him into that little entanglement prop thing that we have back there that all the wires run through. And he tried going through, like, a bull in a china shop, which you can't do. He's like, I'm just going to just tear through this thing. He gets on all fours, and he gets, like, 2 inches into it, and then he's like, completely hung up. And it's like, so finally I stick my hand down, and I'm like, how you doing? He's like, sir, I think I'm stuck. I'm like, you are very stuck. I was like, so remember when we talked about, like, taking it easy, use the technique. I was like, was your way the right way or the wrong way? He's like, my way was the wrong way. I'm like, all right, you want to pull that, come on out and try it my way? He's like, no, I can do this. I'm like, all right. I'm like, but just let you know, we got lunch in 2 hours. So if you can try and get out before 2 hours. So he goes like another half an hour, and he gets to that point because he's all blacked out, he can't see anything. He gets to that point where he's just like, just not moving. Because you start to panic when you can't move, when you're so stuck you can't move, and you're just like, I just see him breathing. I'm like, how you doing? There's nothing coming from him. So then, this was right after he did his thing. I was like, you are still conscious, right? He's like, yes, sir, I am. I was like, all right. I'm like, I'm gonna give you like 15 seconds to get out of there, and then you're gonna do it my way. So he comes back out, and then he goes in and does it my way. I'm like, all right. Makes it all the way through within like a minute or two, and I'm just like, okay, so just so you know, I have my eyes on you the entire rest of these next 2 days because you're not following directions and you're just going too full tilt on this. And so it was pretty interesting watching him go unconscious because he was working hard, and it was a matter of 5 seconds, and he was out cold, right? But what it does is that gives him those 6 minutes of life potential versus breathing the poisonous gases. Okay, all your optic nerves, all your facial nerves. You guys got all these memorized?
Every single one.
Ten of them.
PTSD.
Well,
I did, I did.
In anatomy?
Yeah.
In A&P, did you guys have some long drawn out saying that helped you memorize all these?
No.
Can anybody remember that long drawn out saying? Okay, so I'm gonna give you a little hint here. There are two facial nerves that we don't really care what the names are, but we do care how they function. And that is 5 and 7, your trigeminal and your facial. Okay? And with those, the reason we really focus on those is because those are associated with some of our stroke assessments that we do, with our facial grimaces, our facial muscles, our tongues, cheek sensation. So those are the ones that we really kind of pay kind of close attention to, just in the assessment aspect of it. Know the name of them? And who cares, right? But just know it's 5 and 7. Those are the ones that affect a lot of our assessment stuff. All right, some of the facial components we kind of talked about. Up front, got those ones there. So there's those two, the trigeminal and the facial. Optic stuff, optic trauma. If somebody loses vision in their eye immediately, is that an emergency?
Touch and feel.
What are they talking about back there?
It's a waiter.
The actors in.
Oh, what do you got?
Okay, fine. We're all in med class. To touch and feel a girl's vagina. Ah, heaven.
I didn't say it this time.
Goes up there. Come on.
Well, he didn't read it. It was like he didn't make that
Amanda
up.
told him that.
Olfactory, optic, ocular, trochlear, trigeminal, abducens, facial, vestibular, ocular, mesofacial, geo, vagus, accessory, and hypoglossal. Now you just gotta say that out loud while you're doing it in your assessment.
It's all how you document it.
So moving on to the optic.
Okay, moving on.
Optic stuff here. So, acute onset of loss of vision is is it an emergency? Yes. Is it a code 3 transport? Probably not, but it's a recognition that there is an emergent situation going on. Yes.
Can you talk about?
That's an eye.
Still stuck on.
Can you talk about why it's contraindicated for some medications to have narrow angle glaucoma?
No,
Yeah,
I can't.
good, good.
Because I have no idea.
You know all the things.
I know a lot of things. I do not know all things. There's a lot of things I don't know. There's a lot of things you guys won't know. And there's a lot of indications and contraindications where you can't make sense of, you're like, this doesn't make sense to me at all. But some patient somewhere in the world had some sort of reaction of some sort at some time, and that's why they came up with a contraindication. Like, that's why if you look at contraindications for medications,
They're different.
it's everything that could possibly happen to you, right? So I could not tell you why narrow angle glaucoma affects any of the medications. Yes, unless you have an answer.
No.
Okay.
So I recently went to the ER because I hurt my eye. I noticed that on our medications, like lidocaines, like 1 to 2 drops and repeat is needed.
1 to 2 drops or proparacaine,
Or, sorry, Allocaine.
which is proparacaine.
Yes. So they did put that in my eye at the hospital, but they did say like, I think he said like what, like more than like 6 drops going to burn a hole in your eye.
So that's why they say that's why you follow directions.
Well, no, on our protocols it says 1 to 2 drops and repeat as needed, but there's no like max on there. So it was like,
So, did the 1 to 2 drops work on you?
no. Well, it worked for like very
little bit.
briefly, and then they had to put more in. I think they put like how many?
So I think-
total, yeah.
So I think the idea is not to drip, 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 drip. Because what happens is you'll end up flushing it out over time, and every time you blink, you're losing some of that medication. It's not sitting on your eyeball, whereas if you just drip, drip, drip,
6
you're just
drops
basically
works.
like putting like a welder straight to your eye kind of thing, where it's just like constant contact.
Okay.
But I've never heard of anybody burning a hole in anybody's eye with proparacaine. But did they put a Morgan lens in your eye at all?
A what?
That's a no.
That's a no.
They didn't.
So a Morgan lens. So that's why we use proparacaine. So we basically use it if we're going to be putting a Morgan lens in. And so we don't have any Morgan lenses, do we? Here.
What do they look like?
So Let's go here. These birthday lists is forever.
You can erase that.
Okay, so you got your bag, your IV bag, right? You got your tubing. Okay? And so what the Morgan lens is it hooks on the end of your IV tubing, and it's about that long. And so it's like a cannula type, or kind of like a cannula thing here. And then it just looks like a contact lens on the end. Okay? And so the fluid runs in and it can flush, it flushes the eyeball, right? So you're flushing, they got something in their eye, it's painful. The globe has to be intact, right? So if basically if they're damaged to the globe, then you can't use it, right? So you flow fluid and you're just flushing that eye, you're rinsing the eye out, okay? The funny thing about this is, when you put that in, so put the proparacaine in. Oh, this doesn't have pictures.
Yeah.
Just for my table,
Just
sorry.
Google, what do you got? Oh, well, that's not even.
Allie's got it too.
I got it.
And so you put that in the eye. Oh, okay, Allie, okay. See, what fun is it with Google, man? Like, there's no drawing, there's no
Oh, look at
explanation.
that, that one's cool.
It
One's a-
looks very similar to the picture I have, you're drawing.
Very artistic.
I'm just gonna stop drawing. I'm just be like, hey, why don't you guys Google it and look it up?
No,
Why don't you guys
your
Google how to
drawings
be a
are
paramedic?
better.
You know what, Allie? If you guys will just
I watched a
Google how to be
YouTube
paramedic-
on paramedic. What's
Google how to be a paramedic
Oh, we
and.
have.
and-
we have.
Oh,
Your
I know
picture
you guys
shows
do.
up.
Yeah.
I like your halo drawing.
Yeah, it was good. I didn't Google that.
All right, so when it comes to the Morgan lens, so the Morgan lens goes in, you rinse it out, right? So the funny thing is, when you put the lens in, so you put it in like a contact, like bottom or top or bottom, right? And then you run your fluid, and then you go to take it out. So I learned this watching somebody do it the first time as a paramedic. So I had this big trucky firefighter, and I had an idea of what was going to happen.
What do you mean, big trucky? Got it.
I break doors.
I go to roof, that's LA.
Right? So I'm a small truckie now,
Yeah.
right? And I do a lot of this. I do a lot of pointing. I'll be like, hey, I need you to cut this. I need you to break that door. I need you to do this, right? So I really have to exercise these muscles, right?
You do need
I
one.
I can communicate and I can explain things because I'm on A shift. If I was on B shift, I'd be like, that's how B shifts would roll, right? So he's sitting there and the guy got some chemicals in his eye, and so we're rinsing it out and everything, and the bag runs dry, right? So we're like, oh yeah, we're probably good, right? So he goes to pull it off the eye, kind of the same way that he put it in, top to bottom or top, whichever way you went in, right? He goes to pull it, but there's no fluid there now, right? So this Morgan lens has now created a suction cup to the eyeball. So this big trucky is like, and he just starts pulling, and like you see this dude's eyeball like coming out, like starts to like pop out, and he's like, and he didn't speak any English, and
The
he,
trucky or the patient?
the patient,
Better than Chucky.
like I don't know what he said, but it was not good. And like he was laying down, and he's like following it up off the thing, like trying because it was so painful, and I'm like, whoa, 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 and it like just looked like his eyeball had just elongated because he had so much suction, and he just like, and he's like, hey, hold on, let's try something. I'm like, let's just stick a flush right on the end of this and one of the ports, and I'm just like, let's give a little fluid to create a little barrier there, and like, we'll flush as we pull it off. And he looks at me, he's like, are you an idiot? I'm just like, well, I think it's gonna be better than what you're doing now. So we push a little fluid, and the thing came right out, right? So just know, you take it off, you have to have fluid still running. So as you start to get low on your bag, be planning, be thinking, be like, oh, let's get this off, or let's do this, let's put some more fluid in there, let's do something here, so. I'm just kidding.
Good story.
Is there a halo test to detect ocular fluid?
No.
Okay.
Anyways.
Anyways, let's see what Corey has to say.
Hopefully it puts Moodle up.
Are you teaching today?
I quit. Oh,
He's
good.
got a whole new
Good,
list
I'm
of things
fired.
for you to
All right, I'll
teach.
see you guys later. Oh, jeez. You know when you gotta do one of these during a text? Later, I guess. We don't have time. So, optic stuff. So nerves, nerves and blood vessels. This portion right here, you run the potential. So if you have acute onset of loss of vision, you have the potential that you could have thrown a clot in one of these vessels right here. Okay? True emergency. Not code 3, but hey, no, this is not a hey, let's go see your eye doctor kind of thing, right? My brother had this happen to him when he was in college. He was walking to one of his classes up at Western, and like all of a sudden it's just like boom, gone.
Like both? Or
No, just one. And he's just like, he kind of stops for a second, he's like doing this one thing, and then he says all of a sudden like your whole balance and everything, like when it acutely happens like that, he's like, it was bizarre. He's like, my balance was off a little bit, and he's like, I couldn't figure it out like for a good couple seconds, because you're just walking along and all of a sudden it's just like boom, like half your senses are gone. So he's just like, oh hey, I'm just gonna go see my eye doctor really quick. And so he went there, and the doctor's like, oh hey, you're really lucky. And he's like, oh really? All he did is he had a spasm of these muscles that were along the nerves here. So it spasmed a little bit, just diminished the blood flow. It didn't cut the blood flow off completely, but it made it to the point where, like, eventually he was given like actual muscle relaxers for an eyeball thing, which was weird. And like within like 15, 20 minutes, everything was back to normal. Well, the doctor was just like, hey dude, so just so you know, if this ever happens again, don't come see me. He goes, because if it's legit and there's an actual blood clot there, it's something that needs to be taken care of right away, right? So acute onset of vision loss is a big deal. Blurring vision, big deal.
Depends what the
vision?
cause is.
Acute.
Yeah.
Acute onset without drugs.
So vision is one of the things that we look at when we're looking at stroke stuff as well, right? So blurred vision, loss of vision, anything like that can lead you down the stroke path as well. Trauma-wise though, basically the only thing we're really concerned about is intact lobe. What happens if the eyeball is hanging out?
But it's intact?
Yeah, do we put it back in?
Probably not.
Do we put it in a little glass of milk? Dipping?
Is that a thing that people do?
It's gotta be a
Yeah,
whole.
this is what people do.
Yeah, I
Heard
know.
of
do it
that.
with
Heard
teeth.
something like that.
So you do it with teeth?
Yeah.
Wait, what?
There's calcium.
Yeah.
The calcium.
So what do we do if you got an eyeball dangling out?
Treat it like an evisceration.
Yeah, so basically you wrap it up, you try and keep it moist, right? Wrap it up. If you got a cup, cups are really good. Like a
Urine
paper
cup?
cup. Put a paper cup, you just put the paper cup and just tape it just like that, right? With a bunch of 4x4s that are saline soap. Conjunctivitis.
That's where you
Bad?
put a wet guy.
Botanic acid.
Yeah, I was gonna say it's pink eye, isn't it?
What is conjunctivitis?
Pink eye?
Inflammation of the lens of the
It's
eye.
an infection of the eye.
And what is it? What do we commonly get called on? Pink eye, right? Because somebody wakes up in the morning and their eyes are gooeyed shut and they're like, what is going on? And you're like, instantly you're like, I'm not touching a thing. I want nothing to do with this room. I want nothing, right? So pink eye, probably, I feel it's the most contagious thing in the world. Because it's legitimately like, I see you over there, oh, weird, my eye itches all of a sudden. Right? So you got two things that are like the most contagious things in the world. You have conjunctivitis and you have lice and scabies, right? So like, from you to me, that's too close. Like,
What is dirty kid thing?
I'm like way over here, I'm just like, I can still see the bugs. Right? First time I ever delivered a baby, it was the awesomest thing ever.
Oh.
I was so excited. I was just like, dude, we just delivered a baby in the ambulance. That was awesome. I was like, that was so fun. Like, it was right at like 6 o'clock in the morning. We're going home at 8, right? So like this, I was like, this was a great way to end the shift. Like, this is amazing. Like, right? I'm in my car, like pulling out of the parking lot. And like one of the firefighters is just like running through the parking lot. I'm like, shit, that's not good. I'm like, I already left. You can't get me for overtime. I'm gone. I'm not here. They're like, you want to stop? I'm just like, oh, okay. So I cracked my window like that far. I'm like, what? I'm like, I'm not coming back to work.
Pubic scabies.
Scabies over the entire body, top to bottom,
Who did?
and lice.
The mom.
The mom, right?
They can't really be on the baby yet.
And so, I mean, I don't even care, like, I mean, if you guys had lice or scabies, I don't care, like, but like, hey, no big deal, right? But I'm like I'm a big time germaphobe, like as you can see, I'm constantly like doing stuff, right? Well, that kind of, like little bugs, I do not like little bugs, right? One of my daughters got lice one time and I almost burnt our whole house down. She almost ended up with a shaved head and I was like, you cannot have friends ever again. No friends, no nothing. And I was kind of serious, but kind of joking at the same time.
Oh, I put
But yeah, so this mom had scabies and lice over her entire body. And so I'm just like, okay, I'm burning all my clothes, I'm getting out, great. It's
You
my
were in your
now.
car.
What do I do now?
Burn
I'm
your
like, "It's
car."
my car. I'm just like, right? That's why you never have a good car that you drive to work. Okay?
Or get food.
So it's just, so I don't even know where I went with this story, but it just freaked me out.
What did you
Back
do?
to conjunctivitis. Yeah, so you go into full decon, you throw everything, I got the scabies cream, just in case, which is super expensive apparently, but it's all work on the job stuff, so they're like, hey, we called in your prescription for you and everything, and they're like, so, try not to take it because you gotta put it over your whole body, and then you gotta let it sit for a while, and I'm just like, this is like one of those like crazy Bill Murray movies or something like that, where you're like covered in Vaseline or something like that.
Which movie was that? I missed
I was
that
gonna say,
one.
what's the movie
It
was that?
wasn't, I think it was Burt Reynolds actually. So it's just that kind of, it's just bugs and all that. So conjunctivitis, super contagious, right? People will call you for it. Decon everything. Do we do anything for it? Is this a Morgan lens case?
No.
No, right? So just know that there are emergencies with the eye and there are non-emergencies in the eye. Just you recognizing what they are, right? Okay.
Do you have a pupil-sized talk by
That's
chance?
horrifying.
Like what's good, what's bad, what's ugly?
Yeah.
Little bad, medium good, big bad.
Equal, non-equal? Yeah.
I do have some right here.
Okay.
Okay. Next is, we got that, scalps. You guys remember Derek's story about the scalp, right? So don't fold that scalp over and shove it in the C-collar. Bad or good?
Bad.
You guys probably can't see that.
Supposed to.
You're not gonna fall asleep, are you? Don't fall asleep. I just need more color for you. Bad or good?
Bad.
What does this mean?
Basilar skull fracture.
I don't know what a basilar skull fracture is.
Means you
Fracture
fractured your
at the
skull and
bottom
it's
of the
leaking.
Of the skull.
So the bottom of the
around-
skull is broken somewhere, right?
Yeah.
Yeah.
Around
Somewhere
the
down
foramen
there.
magnum.
Blood pools. Your battle sides are commonly from an orbital fracture, which is weird, right? So you end up with a fracture way up here, and it can end up over here, right?
Go down the eustachian tube. Can't flow down the eustachian tube, that's why it's pretty.
Yeah, and so not only do you end up with the eustachian tube that way, that's where you end up with a lot of your CSF fluid coming out because you have a fracture right around the actual drainage tube there. So early onset, late onset.
Late.
Late, right? So this guy probably fell a week ago, if it's a slow bleed.
Which
Okay.
way? Both? Or saying both of them? Is that
Yeah.
the same guy?
You know, it could be,
It doesn't look like.
it
Doesn't
doesn't
look
really look like, it looks like
Right.
his eyes are a little bit better there. But what do they call these?
Raccoon eyes?
What do they call this?
Battle signs?
Yeah. All right, so you got your basal skull fractures, cranial fractures, open, impaled objects. Do we pull impaled objects out?
No.
Take a look at this depressed thing here. That's where you stick the finger disappears in there. So this is one where you're gonna put a light.
That was really good.
So you just put it lightly over the top of it, just basically
Jig, yeah.
hold it in place there. Open fracture. What about that? What are we looking for there? When you have an open fracture, what do you want to look at?
The depth.
You want to look at the depth. You want to see, can you see gray matter? Can you see gray matter splatter, right? Has anybody seen the brain? Seen the brain outside the body? Like on the concrete or anything like that?
I've seen like
Slab doesn't count. So when you see it on the concrete, it takes on a little bit different shape, look to it than in the lab. Because you're not gonna see the whole thing. If you can see the whole thing on the concrete, that's pretty
That's
impressive.
impressive.
Very
Very
bad.
impressive. But like, if you get that opportunity, because there will be patients that are alive that have brain matter on the ground, like chunks of their brain on the ground. That is something you want to pass on to the ER when you get there and be like, hey, by the way, this was on the ground, right? Pictures are really good for
Put it
that.
in a glass of milk.
Don't put it in a glass of milk. Wait for the glass of milk.
Do you take the bits with you?
No,
Okay.
they're not gonna reconnect the brain.
Pieces of skull?
Is a skull. You take that with you.
Yes.
Is that what you're asking?
Yeah.
I'll
Put
put
a
a plate.
severed leg, bring it with you.
Bring the leg with you.
Bring the leg
Bring a
in.
big leg with you, right? So they have all kinds of things that they can replace bone with. They do bone grafts, skin grafts, eye grafts, no, not eye grafts. But they have stuff to be able to replace it. If it happens to be laying right next to the person and there's a big chunk of skull like that, I would take it with me. But if it's something where it's like I gotta take more time to go collect the pieces, be like I got one piece here, one piece here, one piece here, I'm not gonna take the time to do that because they have titanium, they have stuff that they're gonna be able to do that way. Okay. Gosh dang, that's why you never get a group text. Okay, Laporte fractures. So as we're checking the face, okay, so you have 3 different styles. So this Laporte 3 is basically, let's see, I think I have a picture of my whole front hand. So you can see here, this is fractured, the Laporte 3 is fractured all the way across here, and so there's basically 2 different parts, right? Would you say that's bad?
Yeah.
Okay, what about this, Laporte 1,
Yeah.
right? So it comes right across, just under the nose, so you're fractured right here, so you're gonna end up with this disconnect floating around here. Is there something significant of concern with the
Yeah.
Laporte 1 would be for you?
Especially with trying to innovate that.
Airway management in this could be potentially difficult, right? Because you don't know, they open up the mouth, you don't know what that looks like up in there, okay? Laporte 2, above the nose, Laporte 1 below the nose. Laporte 3, disconnect of the top and bottom, all right?
Just above the eyes.
Just get, like basically right at the eye, right at
Right at the
the
eye.
top of your orbit there. See, I was being optimistic with 84 slides, you know? Just kidding, I'm gonna go that
We
far.
have 3 hours.
Wait, so what would you do
32?
for intubating that
33.
situation?
Uh,
Because if you do any amount of moving the lower jaw, like, you could cause shearing forces, right?
right here. So if you have crepitus, you go like this and you have crepitus like from here to here, you're gonna be very, very careful when you do it, right? You're not gonna be in there super aggressive, like crying on stuff, trying to get it done, right? They may be a candidate for a king, where you have to do less jaw manipulation. And so it's once again, it's hard to say 100% what you're gonna do until you see what you have. If you have a giant hole in there, like up in there where you're looking up in there, you're like, wow, this is weird. I see brainstem in the back of the throat. Huh? Bad, right? This may be a straight to a cranky type of a thing. It's just a lot of it just depends on the situation, and you have to think through and be like, okay, if I do this, what are the consequences? What potential damage is going to occur? And is this person dying already and going to be dead if I don't do this? That's the kind of stuff that you got to think. All right, so we got the vital signs for your auditory canal and lower areas, raccoon eyes, orbital fractures.
Will the raccoon eyes always be bilateral?
What?
Will the raccoon eyes always be
No.
bilateral?
Nope. So your orbital fracture, if you just took a shot on one side, it's like having a black eye. Right?
But if it's basilar, maybe.
Then, yeah, okay. So you got a couple signs of it.
Is that general mass?
All right, so here's your halo test. We talked about this, your coup contra coup stuff. One impact, then the second impact. All right, so here we go. We talked about that one. All right, so there's our epidural bleed. Fast onset, lucid interval, right? So the one thing you would take away from this is the lucid interval and acute onset. This one's a fairly quick one, right? That's bad. Do you agree?
Mm-hmm.
Yeah?
So do they go in there, like, do they drill through the skull and like, just like drain it?
A lot of times they will, yeah. So a lot of times what they'll do is they'll actually remove this outer section of the skull and just basically allow it to swell, and people end up with this large, just drainage, and they're just constantly draining. All right, subdural bleeds. So below the dural matter now, okay? So with these ones are the person fell or had the trauma like a week ago. Okay? This is the slow onset type of a bleed. Can they be acute? Absolutely. But most of the time they're going to present with a slower onset. They fell down, hit their head. Hey, I was doing something with my trunk and I hit my head a week ago, and they're on Coumadin, something like that. They have this slow bleed buildup. Okay? Can they have lucid intervals? Not usually, because of the fact that it's this slow onset, right? So it's just a bleed that's just occurring, it's just slowly oozing in, it's slowly causing ICP. A lot of times these people will present how?
Drunk?
Nope.
Altered LOC.
Getting closer. So what normally happens if you have a bleed in your head?
Crazy.
Non-traumatic.
Stroke.
Yeah. So a lot of times you're going to get called for a stroke in these patients, right?
Hemorrhagic bleed.
And so you end up with a stroke call because they're getting pressure on one side of the brain, which is causing paralysis deficits on the other side. And so next thing you know, you're like, oh, I'm doing a whole stroke assessment. And what do? What do you forget?
Trauma.
Right? What do you forget to do, though?
Ask if they had any.
I heard it. Who said it?
History.
Take a history.
History. You don't do a good history, right? So anytime anybody ever presents with a stroke, you always want to ask about recent trauma, right? Because if they have blood thinners, if they have recent trauma, anything like that, you're suspecting what type of stroke versus ischemic stroke.
Hemorrhagic.
Right.
The only other one.
Yep, hemorrhagic versus ischemic. Well, you know, some of you guys may come up with some crazy random third or fourth reason for a stroke, okay? So slow onset to that. Subarachnoid bleeds. Where are subarachnoid bleeds happening? Other than below the arachnoid area. Yeah, use for that one. That's first. So where would a subarachnoid happen? Where's the general area? Any idea? Do I need to go back and show you where the arachnoid
Yes,
is?
please.
Yes.
Between the arachnoid space and the dermal.
Is that more on the surface?
What's the difference
So
between
basically, it's
that?
between the dura mater. So you got the dura mater and you get the cranium, and then it turns into this entire thing, right? So you end up, so basically you can have a bleed anywhere in the vault of the skull, and your subarachnoid areas, those are some of your pretty significant bleeds. Those are also artery-related bleeds. Most of these are not trauma-related. Most of these are the somebody blew a vessel and is stroking out and is having their hemorrhagic strokes. Okay.
Oh, you made the 40s. Good job.
Boom. So here we go. Here is that. So this person had a bleed. Looks like it was a maybe an epidural or subdural a little bit. You can see it on the outside over here. All right. And so what did they do?
Remove half
They
the
took
skull.
off that section of
They
it.
took that whole skull out, and look what happened with the brain and swelling and blood and everything. Basically, everything just extended out there, right? So that's how they would fix that. Okay.
Does that like go back down and then they put a titanium like in there, or is that just like permanent, like they just don't have a skull right there?
So a lot of times, some of the times what they'll do is they'll actually basically just make a cut here and a cut here, and they'll basically use the skull as like a helmet protector on the outside of it. This one you can see, I don't know if they are still NCT, just taking a look at it or not, but a lot of times they take that skull and just kind of set it on the outside and keep it intact. And then as the swelling goes down, then they go back in and they work on reattaching it. They do, sometimes they'll completely keep that removed, where you'll end up with an indentation up there. A lot of it just depends on the situation and the recovery of how they do. All right, concussions. All right, so you go to the local football game, local high school football game. You get a kid on the sideline, they say, They think he got knocked out. He was unconscious for a second, and now he's sitting on the sideline. How do you approach that?
Worst case scenario.
Always worst case scenario, right? So I'm thinking right now, he has a what?
Slow
Like brain
leg, brain bleed.
Not a slow brain bleed. I'm thinking he has an epidural bleed that he's gonna become unconscious, go into seizures right in front of me and in front of these 4,000 people watching this game.
Big high school, jeez.
I don't know, how many people show up to
Six.
Sheldon? There's probably 4,000 at Sheldon, right?
50 come to South.
50 people go to South, okay. Alright, so let's say, okay, I don't know, you guys.
We get the point though.
Yeah, so you got a lot of people watching you, that's what I'm saying, okay? Those are, I hate walking out in front of people. Especially like, the football game's like on hold, as both teams are off the thing. They'd call 911, get us there, so it's like 10 minutes, and people are like, what took you so long? It's like, not our fault, sorry. Like, it took us 2 minutes from the time we got the call to be here, right? So you're walking out onto the field, you're walking out on the sideline, something like that. And so you got this guy sitting there on the sideline, on the bench, like just hanging out. He wants to go play some football. He's mad. Parents are all upset, trying to figure out what's going on. Coaches are like, oh yeah, he's not acting normal.
Hey, let's go step in the back of the ambulance real quick. Let's just take a look at it.
Yeah? So the ambulance is from here to the very end of the track,
Let's go behind the stands, away from front of view.
right? So you want to get out of visualization, right? As much as you can. Or you do a quick, give me a little history of what's going on, hey, what's happening, and make a quick determination, okay, yeah, you were knocked out? Okay, so we're gonna speed up a little bit now. I'm not gonna tell you we're speeding up, but I got a lot more quick questions I'm gonna ask you. How you feeling? You got a headache? You got this? Numbness, tingling sensation? Because, like anybody gets knocked out, what are we thinking about in our assessment? Let's not think brain right now for a split second. C-spine, right? So boom, we instantly have to think about that. Right, okay, so now we got C-spine, we got somebody that's gonna die because they're bleeding in their brain. Okay, we're gonna RSI this person. So you got all these different things that start popping into your head, and you're in front of everybody. And so this whole, hey, let's get them someplace like to talk, now becomes okay, I'd love to get you out of here, but if I stand you up and all of a sudden you collapse because now you're paralyzed because you had a fractured neck, it's like, God, you really dropped the ball on that one, right? Oh, and there's
80,000 people
I was gonna
now.
say, now there's 20 people up there with their cameras on you. The 80,000 would have been good. But so now you got people watching you, because obviously everybody's videoing all the time, right? Especially when you're in public, so you've got to do it the right way every time. So somebody that gets knocked out, it's gonna be hard not to C-spine them, right? Especially if it's a football style accident, right? So that's significant trauma to the head, and now he's got some sort of weird altered LOC, so now you can't really rule it out. So you got all these different things working against you on wanting to do exactly what Chandler said of, I want to get you kind of in a private spot so we can talk. But it's like, oh crap, we legitimately have to do this, right? So you gotta get quick at your assessment and get right to the point of trying to figure out whether or not this is a transport, no-go, what's the deal here, right? So C-spine, right? So somebody's gonna be holding C-spine while you start talking, right? Palpate the neck real quick. Hey, is any of this hurt? No, nothing here. All right, tell me what happened. Oh yeah, you guys went head to head, top of the head, and you got knocked out. Okay, let me double check your neck again really quick. Boom, 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 that. You sure that doesn't hurt? Yeah? Do a little range of motion check. Okay, yep, good there. Okay. All right, so we're good there. Okay, yeah. So alert and orient times 4, person, place, time, and event. Hey, what happened? Right? After you already figured out, because you already talked to them, what's your name? How old are you? Where are we at? What happened? Right? Yeah. Yeah. Wait, where am I? What happened? What am I doing? Right? You just answered those questions a second ago. Right? Now, repetitive questioning, right? Has anybody ever talked to somebody with repetitive questioning? Mons, did anybody talk to you? Did you have repetitive questioning?
I kept saying I didn't want to go.
Right, do you remember saying that?
Some of it.
Some of it, right? So I got a concussion almost identical to this scenario I'm telling you. I went head to head with a guy, boom, hit. I swear to this day, I stayed on my feet. Right? My buddy came over, picked me up off the ground. He's like, wow. He's like, you all right? I'm like, oh, good to go. Good to go. right? Started running the wrong sideline, no big deal. He redirected me, I went over there. That was like the 5th or 6th play of the game. I played the entire first half of the game, right? Funny thing is I'm a quarterback, right? So what am I doing? I'm calling the wrong plays, I'm running the wrong direction, and coach doesn't even pick up on it, right? Like, and to this day, I have like probably 5 memories from the game. Don't remember a whole lot. I remember at one point I lined up out at the wide receiver position, and they're like, dude, what are you doing? I'm just like, we're running a trick play. Like, I was trying to justify to them why things weren't making sense to me. They're like, no, go back over there. I was like, okay, so I ran back over, and so finally at halftime, I come running off the field, and I'm just like, we're running into the locker room, I'm like, hey, coach. He's like, what? He's like, I don't even know where I am right now. I was like, I don't even know what I'm doing out there. He's like, what do you mean? He's like, I was like, I don't know where I am, I don't know what I'm doing, I don't know what play I'm calling, I don't even know what I'm supposed to do. He's like, well, go sit on the bench. I'm like, okay, so I went over and sat on the bench. I'm just sitting there, somebody came up and apparently had talked to me during halftime and stuff, and I don't remember any of that. And then he's like, all right, and my coach is like, all right, you're going back in. I'm like, okay. I go to trot back out, and luckily there was another coach there that was a close family friend, and he's like, hold on, come here for a second. He starts talking to me, and apparently I had like this deer in the headlight look. Like I was looking past him, I couldn't focus on anything. This is where I was talking about that tunnel vision stuff, where you got darkness around the outside. That's all I saw. Like, I was just like, he's like, hey, let's go talk to the medics over here. So we go over there, and like apparently I was just making no sense, and like it was getting worse and worse and worse. And I had no idea. I was ready to just keep going. But like I had just bits and pieces, and finally they made the determination. They're like, all right, well,